Ready? My name is Austin Campbell. I'm doing an NG tube insertion. I'm an FSCJ student here at the nursing program, and I'm also going to be doing the irrigation. So I have checked my medical record and my physician's order, and I'm going to be doing a NG tube on my patient. So I'm going to knock on the patient's door. Hello, my name is Austin. I'm going to be your nurse today. Can I verify your name?
Robert.
And I'm going to check that against his armband right here. And your date of birth?
9/4/61. My name is Robert Davis.
Robert Davis. All right, Robert Davis. Have you ever had a NG tube before?
No.
Okay. Basically, I'm just going to insert this into your nostril and down into your stomach. Okay.
Okay.
I'm going to go ahead and check the client's nares and oral cavity real quick, and I'm going to have him include one, and then include the other one, and check the back of his mouth. And it looks like the right nare is going to be a little bit more open, so we're going to use that one. I'm going to go ahead and measure the NG tube from the nose around the ear and to the xiphoid process, and that's going to be right at 55 inches. Alright, get my patient set up here with that right there, and then I'm going to go ahead and do hand hygiene and don my gloves. Tell the patient that I'm going to get ready to start here in a second, and I'm going to go ahead and apply lubrication 4 inches up from this. And alright, so I'm going to go ahead and tell the patient that we're going to start. I'm going to go ahead and tell the patient to lean his head back up against the pillow and go ahead and slowly insert it. And he is not coughing or anything. I'm going to keep going a little bit further, and I'm going to check for coiling the back of the throat. Okay, he's not coughing or choking, and he's able to speak. And so when I feel a little bit of resistance, I'm going to have the patient lean forward, and I'm going to have him drink a little bit of water until he keeps swallowing, until I hit my mark. Alright, and once I hit my mark, I'm going to, the best way to make sure that the placement's right is going to be x-ray, but I'm going to go ahead and check with some air, and as I listen to the left epigastric area. Okay. There. Okay. Alright, so I heard a swooshing sound. And I aspirated another 30, and I'm going to disregard that. And I'm going to anchor my tube using a wide piece of tape. Okay. I'm going to use a safety pin and a rubber band and connect it to the patient's gown right here. And I'm going to attach this to low intermittent suction, and I'm going to state the insertion documentation, time of insertion, the NG tube length, and the type and the color that was aspirated. And I'm also going to do my irrigation. So after this is connected to the low intermittent suction, I'm going to disconnect this, and I'm going to implement a standard protocol, which is a position client in the correct position. I'm going to go ahead and say right now, I'm pause and say that this is the same patient. I've already checked the allergies, and and I have re-donned gloves and redone my hand hygiene. So I'm going to disconnect the NG tube from suction, and I'm just going to go ahead and lay it right here on the towel. Okay, and I'm going to check placement of the NG tube using a 3 ml syringe, and I'm going to pull back 30 mLs. And then I'm going to place the stethoscope. Over here. And insert it. And I heard a swishing sound, so the placement's still good. So now I'm going to use 30 mLs. I throw that away. I'm going to use another sterile, and I'm going to get 30 mLs of sterile water, normal saline. And I'm going to measure the solution and go ahead and put this in here. And discard of this. Reconnect this to the low intermittent suction. And I'm going to state the irrigation documentation, the type and amount of irrigation, the solution, and the difference of the volume was not, I'm going to do the 4 Ps. I'm going to see if the patient has to go to the bathroom, their personal belongings, pain, and the 30 mLs I pulled out. You want to stop it?